Hello, this is Cara Tupps, and I'm giving a midterm report for the Rotary Foundation Global Grant Scholarship. I've been studying at the London School of Hygiene and Tropical Medicine, and my program is a Master's of Science in Public Health for Development. Since the course began in October, I've completed 7 courses: Extended Epidemiology, Statistics for Epidemiology, Health Policy, Health Economics, Social Research, Conflict and Health, Designing Disease Control Programs in Developing Countries, and a lecture series on current issues in public health. So far, I already know that I've developed many skills that will be extremely useful upon re-entering the workforce. For one example, I've learned to conduct policy analysis and to draft recommendations for changes to healthcare policies. I've also learned to collect statistically significant data and to determine risk factors for disease via statistical analysis. I've also participated in many meaningful discussions on how to improve health programming in developing countries and discuss various options for overcoming key challenges in the implementation of these programs. I feel as if I have a foundational understanding of public health, which I definitely did not before, and that my breadth of knowledge on the topic has been greatly extended. Many of the topics covered are extremely relevant to the Rotary Foundation's goals as well. For example, I had the privilege to attend a topical lecture on the challenges facing the polio vaccination campaigns. It was given by Dr. Paul Fine, a lecturer here at the school. A number of issues threatening the eradication of polio that he mentioned were directly relevant to material covered by my classes. Concepts from epidemiology helped me to understand his explanation of herd immunity, the thresholds for vaccination, and also the risks for the side effects. Principles of public health policy framed the discussion that we had surrounding the international politics of various vaccination campaigns over the years. And discussions from conflict and health gave context for the various threats to immunizations by conflicts in areas where eradication efforts are underway. I have no doubt that the remainder of the program will continue to give me this contextual knowledge that's highly applicable to improving the health of neglected and vulnerable people worldwide. Most of the assessments so far for the course have been formative, meaning that they were graded but will not officially count toward my final grades. They have been a mix of research papers, short essays, group projects, analysis of research publications, and formal written examinations. The grading system works on a scale of 1 to 5, 2 being the lowest passable grade, and 5 signifying that the work is good enough for publication. So far, I have received high marks, all 4s and 5s, on my assignments. Some of the highlights and challenges of studying at LSHTM have been that the program is extremely fast-paced. It's also very labor-intensive. This is a highlight and a challenge, I think. It has definitely tested my abilities. I spend an estimated 20 to 30 hours on readings every week. That is aside from time spent in lectures and class. And there are so many networking opportunities, additional optional lectures, and other events at the school that I definitely try to take advantage of, but this becomes very difficult when factoring in the other basic necessities of life and the time that takes, as you can probably imagine. Despite this, I do feel that I've been able to find a good work-life balance, and I've definitely been enjoying my time in London immensely. I also want to recognize that this is definitely achievable only because of the generosity of the Rotary Foundation, the supporting clubs, and my sponsor and host clubs. So I am tremendously grateful for the opportunity to be able to pursue my studies full-time. Another challenge related to teaching style at the school is that there's very little hand-holding done for the students, and this is different compared to my experience with the higher education system in the US, but I do believe this cultivates a lot of critical thinking and is very good practice for the world after graduation. There's also a lot of experts in nearly every field of public health at the school, And I find that the teaching faculty will really go out of their way to make time for students interested in talking about their research and various experiences. Additionally, since my program requires applicants to have a few years of field experience, my cohort is made up of people who have been working in healthcare in many different capacities. These include practitioners such as doctors and nurses, health policy analysts, immigration healthcare advocates, employees of humanitarian relief and development organizations such as myself, and many different others. We also hail from 20 different nations, the majority of which are from low and middle income countries, so there's a lot of different perspectives, and this creates a unique networking environment within the cohort, and it allows us to learn from one another's experiences and to bring our own context into our classes. I genuinely believe this is not replicated in any other MPH program and is especially unique to the London School of Hygiene and Tropical Medicine. I think most of my colleagues would also agree. So looking forward, 3 courses remain for the program. These will be medical anthropology, field epidemiology methods for the control of communicable diseases, and applying public health principles in developing countries. These courses are all very practical in nature, and they'll focus on developing specific tools that can be used in my career, such as methods for qualitative data analysis, real-time disease outbreak surveillance, and how to implement pro-poor health policies in low-resource settings. In June, I will sit for formal examinations covering everything I've learned throughout the program. These exams will count towards my final grades, so I will use the month of May to focus on reviewing key concepts that I've been collecting for each course. From May to September, we are no longer attending lectures, but are expected to be working on our final dissertation. This is also a large portion of our final grade. For this project, I have found a mentor at the school and also a topic of interest. So my project will look at the Ebola crisis in Sierra Leone from 2014 to 2015. And we'll seek to answer the question of why it was so difficult to communicate with people in the villages about ways to prevent the spread of disease. To do this, I will be analyzing data from interviews of government officials, healthcare workers, and people on the front lines of the Ebola response in the affected areas of Sierra Leone. This project will be a part of a larger research study at the school on how to build back resilient health systems in Sierra Leone post-Ebola. So the data has already been collected, and it is my job to analyze it. Additionally, the researchers on the larger study will serve in mentoring me throughout the course of the project, so I will have the opportunity to interact with 3 senior researchers and 2 PhD students at the school as well. My hope is that the recommendations made by my study will help to improve health communications during future outbreaks of Ebola, such as the one currently ongoing in the DRC. Ultimately, I hope that improvement of these communications will help control the spread of disease. Upon submission of my dissertation, I plan to begin applying to jobs in the field of public health. I am still very interested in serving as an advisor for the design and implementation of international health programs, either for the not-for-profit sector or for the government, such as the CDC or NIH. I'm also interested in working for a donor agency, such as the Bill and Melinda Gates Foundation or USAID. In this respect, I would ideally serve a similar purpose, focused on the evaluation of public health interventions and perhaps the development of funding priorities for healthcare worldwide. Again, I just want to say thank you to all of the supporting clubs. I know that this is only by your generosity and support that I'm able to do this, and I am very grateful. So thank you.